Sherman had in fact experienced 16 minutes of something known as anesthesia awareness, where you are awake or feel a portion of your surgery. And shockingly, this happens to 20,000 people a year. In 2006, 73-year-old Sherman Sizemore and his wife Ruby were sitting in their home alone on the couch. Sherman just starts screaming as if he sees something in front of him that's terrifying him. Sherman wasn't able to speak. After he stopped screaming, he just continued to look straight out. Little did they know, there was actually a very specific reason he was acting the way he was. A few months before January 19th, he began complaining of severe abdominal pains, and the doctor, after examining him and running some tests, determined that most likely his pain was coming from his gallbladder. On the morning of January 19th, so again, this is the day that Sherman basically loses his mind, he's put on a stretcher bed and he's wheeled in and prepped for surgery and then brought into the operating room. However, the anesthesiologist only administered one of the two drugs necessary for general anesthesia. He administered the paralyzing drug, but he did not administer the actual anesthetic. And the surgeon takes the blade and begins cutting into Sherman's midsection. Sherman felt everything, but Sherman couldn't do anything about it. And so the surgeon continued to cut into his midsection until he had cut out a fairly significantly sized hole. And the nurse got what looked like a vacuum and pressed it inside of this open wound and began sucking out fluids from his body. One of the nurses standing next to the surgeon looked up at Sherman's face, at which point the nurse yelled out, "Stop, he's awake!" And so the anesthesiologist comes running over from the side of the room. He gets up next to Sherman and begins pumping him full of painkillers, and he does pass off to sleep. The anesthesiologist administered an additional drug after giving all these painkillers. This additional drug was called midazolam, but it's better known as the amnesia drug. And so the idea was, by giving him this amnesia drug, he won't remember the trauma he had suffered through during the surgery, and so wouldn't file a lawsuit. And then when Sherman woke up in recovery, he did not remember what had happened to him inside of the operating room, at least not consciously. And then over the next couple of days, he began having these flashbacks where he would access the actual 16 minutes of torture he went through. But before they could figure it out, the whole situation had just become too terrible for Sherman. And so on February 2nd, he would take his own life. However, Sherman's case, forgetting the amnesia drug, just literally what he went through, 16 full minutes of this really intensive surgery that he felt, that is an absolute rarity. That does not happen very often. Sherman's family would go on to sue the hospital, and they would be awarded an undisclosed amount of money from the hospital in 2008.